Did you know that cats get acne too? And it's not because they're stressed out about their upcoming calculus exams. Hello, I'm Dr. M. Welcome to VMC. Today we are going to address feline chin acne. So let's explore why your feline friend might be dealing with some chin issues. Join me, let's get to the bottom of this hairy situation. You'll learn something today. First, we should address what chin acne actually is. So it is quite similar to acne in people, but in cats, we mostly see it around the lips and chin, kind of on this front face area. When hair follicles become clogged, this is known as a comedone. If it's a severely blocked follicle, that can even progress into a pustule, which means that it's filled with purulent material. Some people might know this better as an abscess, especially if it's bigger, we might call it an abscess. And it's also possible that the skin surrounding these blocked pores can also develop secondary, usually bacterial infections. Cat acne is characterized by the development of folliculitis, so that's inflammation of the hair follicles, as well as furunculitis, which is more inflamed lesions around hair follicles, similar to a boil. So now that we know what it is, let's talk about the causes of feline acne. This is a little bit tricky because we don't fully understand why it occurs in some cats. However, in multi-cat households, it can be an issue that can impact more than one cat, which tells us that there is likely an environmental component to this more than maybe a genetic component, but we don't know that for sure. There's some data indicating that things like upper respiratory infections might make a cat more likely to develop chin acne. For other cats, it seems to be that they might have an overproduction of sebum from glands around their face, and that might make them more likely to have clogged pores. It's also possible that some cats aren't as good at grooming their face as other cats, and perhaps if the face is left more dirty with food and so on sitting on the face all the time, that could also predispose them to developing chin acne. Lastly, we know from the research on this topic that there are some other medical issues that might make the cat more likely to also develop acne. Most commonly, I think about if the cat has allergies, whether that's to a food allergy or allergies in the environment, but anything that impacts the immune system, whether that's stress or other infections or autoimmune disorders like pemphigus, any of those things might also predispose a cat to acne. Lastly, there do seem to be some cats that have a contact hypersensitivity to certain materials. Most often this seems to be plastics, which is one of the reasons why it's never appropriate to use plastic dishes, but we'll touch more on that later. Let's move on to the symptoms that you might notice and what your veterinarian will be looking for when you consult them. So in a very mild case, all that people might notice will be black dots around their cat's face, and those are those blackheads that we were talking about at the beginning of the video. However, they might not be dots, they could even be larger spots or lesions that are discolored around the face. The skin might become red, thick, crusty. Sometimes you might even see that some of the abscesses or pustules drain material from them. They might have hair thinning or complete hair loss. And sometimes, but not always, people will notice that the face is just bothering the cat, and they might be scratching at it quite a bit or rubbing at their face with their paw. There may be some itching associated with these infections sometimes, or if the cat has an allergy problem that's causing them itching. So when you see your veterinarian, we will, of course, do our physical exam. If we are suspecting acne, we may shave the fur depending on the length of the cat's fur to get a better look at the skin underneath and or to make application of topical treatments more efficient. I would expect your veterinarian to also take some superficial skin scrapings to look at under the microscope in order to figure out what type, if any, infections are present. Do we perhaps have mites? Do we have bacterial infection? Just what is going on. That will enable us to tailor a treatment plan appropriately to your cat. If things are severe or not resolving, we may even end up needing to do a culture of whatever infection is present so that we can make sure we're tailoring treatment appropriately. If lesions don't have a typical appearance, I would also expect to discuss a biopsy and x-rays of the skull and or jaw and or teeth of your cat, as we have to think about potentials like different cancers or infected tooth roots and other issues that can cause very similar looking changes to the cat's face. Let's move on to treatments. The options will depend quite a bit on how severe your individual cat's situation is looking and what you think treatment option possibilities will be, as some cats are very hard to get medication into. Sometimes cats can be very difficult to do topical treatments for, and so this will need to be a conversation with your veterinarians that we can do the best at trying to get something as effective as possible for your cat. If this is a more mild case, we can often use only topical treatments. We might use benzoyl peroxide wipes. We might use something like a chlorhexidine wipe. Maybe there will be anti-seborrheic shampoos considered. Sometimes we use topical steroids. There are a bunch of options, but for the more mild situations, usually just skin treatment is all that we need. If we have a more moderate or severe situation, then we will also include medications that you give by mouth. Those might be things like pain management, steroids to help with itching and inflammation. Maybe we're using antibiotics or antifungals depending on what the skin sample showed us. And so those things may be paired together or used separately. It will all depend on your individual cat's needs. If this is a situation that seems to be recurring, it will also likely be recommended that you start doing an omega fatty acid supplementation, as that can help to improve the skin's barrier, and that will reduce the likelihood of the acne returning or making it a less severe issue for your cat in the future. Of course, the most important part of this is that if we know the underlying cause for your cat developing the acne, we need to address that too. So that means making sure we are never using any plastic dishes. We should be using glass or stainless steel. It's of course important that we are daily fully washing those dishes and fully replacing whatever is in them, whether it's water or kibble or canned food. We also need to consider dishes that are more shallow and broader, that will reduce your cat's contact of their face to the dish itself, which can help significantly. We might need to consider things like a proper food trial to rule out a food allergy. I have done a video on what this looks like before. I'll make sure to link that in the description for you if you need that information. You might need to see a veterinary dermatologist to discuss the potential of environmental allergies and so on. Of course, if there are some viruses going on, that's a little bit more tricky, but if we can get any stress or anything else that might be impacting the immune system under control, that will also help to manage the acne. As far as home care and management goes, we do need to look for any potential causes of why your cat might be grooming less. Most commonly, this is because of pain, whether that is arthritis pain or dental pain, other pain. Checking for and ruling out pain is a very important part of the medical workup here. You may also need to help your cat with keeping their face a bit cleaner. That may include washing their face once or twice a day or using a wipe on their face once or twice a day. You can discuss that option with your veterinarian as well. It's not always necessary, but it might be for your cat. Thank you so very much for taking your cat's health seriously. I'm so glad that you joined us for this video today. I do put out a new video most Fridays, and if you have a topic that you'd like me to cover in the future, don't hesitate to comment down below. I love to hear from you and I love interacting with you in the comments. I hope that you have a wonderful week and I will see you in the next one. Bye!